Canada funds its public health insurance through tax revenues collected by the federal and provincial governments, spreading the cost of medically necessary services across the entire population to prevent large individual medical bills. While often viewed as a single national entity, but it's not just one system, it's actually a dynamic network of 13 separate provincial and territorial plans, each with its own local flair. Assuming coverage is automatic is a dangerous mistake. If you fail to understand the administrative rules of your local system, a routine hospital visit can result in medical bills stacking up fast. Navigating this system safely requires letting go of the idea of a passive safety net. You have to actively learn the rules of registration and understand exactly where your geographic boundaries lie. The money starts in Ottawa. The financial engine. It's the Canada Health Transfer, a massive federal cash injection that empowers provinces to run their unique plans. That federal cash comes with a condition. To receive their full funding, those 13 independent plans must comply with federal law, specifically the Canada Health Act. Success depends on 5 unshakable pillars. First, public administration. Second, comprehensiveness. And third, universality. To complete the foundation, we have portability and accessibility. These 5 guarantees are the bedrock of Canadian life. While the federal government enforces broad standards through funding, the actual day-to-day management of healthcare, including the specific definitions of what medical services get insured, is completely controlled by the individual provinces. Eligible residents must actively apply, register, and continually renew their health cards within their home province. It's all about where you live. You've got to be physically present in your home province for a specific number of days every year, or you risk losing your coverage entirely. Once registered, your provincial plan covers what it deems medically necessary hospital procedures, hands-on physician services, and certain surgical dental treatments with 0 patient charges. The delivery of that care operates on a hybrid model. The public system pays the bills, but many family doctors actually work as private contractors rather than state employees. The term medically necessary acts as the critical dividing line. Think of medically necessary as the ultimate border. On one side, public funding. On the other, your own pocket. Provinces determine which medical services are covered in consultation with local professionals, as the Canada Health Act itself contains no master list of specific medical conditions. Anything that falls outside that definition triggers an out-of-pocket patient charge. That includes cosmetic procedures, doctor's notes for work or school, and requests for private hospital rooms. It also excludes everyday medical essentials. Unless you qualify for targeted provincial safety nets for children or seniors, you are paying out of pocket for prescription drugs, routine dental care, optometry, and ambulance rides. The limits of your health card also apply when you cross provincial lines. If you move, your old province will maintain your coverage for a 3-month grace period while you re-register with your new local plan. For domestic travel, cross-country emergency hospital care is covered, but non-emergency treatments require pre-approval from your home province before they'll pay, and subsidies for extras like ambulances disappear once you cross the border. Leave the country entirely and that financial protection plummets. If you require emergency care abroad, your province only reimburses you up to the Canadian equivalent cost. You are legally responsible for paying the remaining foreign balance. The power of a Canadian health card is inextricably linked to geography. The further you move from your home province, the more risk you assume. Ultimately, Canadian healthcare is a dynamic system requiring active maintenance from the people who rely on it. The pooling of tax revenues ensures a massive collective protection. No resident faces bankruptcy due to a medically necessary emergency within their home province. But residents must hold up their end of the bargain. That means managing your provincial registration, budgeting for uninsured services like dentistry, and legally securing private travel insurance before you cross international borders. The promise of universal coverage is only fully realized when a resident understands both the protections against high-cost medical bills and the strict geographic boundaries of their specific provincial plan. No opinions, just facts.